Come in.
Hi, my name is Alyssa. I'm going to be your student nurse for today. I'm going to do a head-to-toe assessment on you today. It's going to take about 10 minutes. Is that okay?
Yes.
Are you in a comfortable position?
Yes.
Okay. I'm going to do some hand hygiene and pull this curtain back for privacy. Do you know where you are today?
My house.
Do you know your name and date of birth?
Jordan Schick, 062398.
All right. I'm going to go ahead and verify that. Perfect. And do you know the date it is today?
March 8th, 2020.
And do you know who the president is?
Donald Trump.
Patient is alert and oriented ×3. Patient's posture is erect. Patient's speech is clear. And patient's hygiene is adequate. I'm going to start off by assessing your scalp for any lesions, bumps, parasites. I don't see any. Hair distribution is appropriate for age. And now I'm going to go ahead and go on to your eyes. Could you take your glasses off for me? Alright, and I don't see any redness, no discharge, nothing. So I'm going to go ahead and check them. Perfect. Now could you look at my nose for me and look at the car behind me? Nose, car behind me. Perfect. Pupils are equal, round, and reactive, slight, and accommodating. Now I'm going to go ahead and have you stare at just my pen light with only your eyes and just follow it. Perfect. Cranial nerves 3, 4, and 6 are intact. Now I'm going to have you look up for me. And no deviations, and no discharge. And could you sniff for me? And sniff. Perfect. And could you close your eyes for me? And let me know which side of your face I'm touching.
Left, right, forehead, nose.
Perfect. Cranial nerve. Could you puff out your cheeks for me? Could you smile? Could you frown? Could you raise your eyebrows? Okay. Cranial nerves 5 and 7 are intact. Now I'm going to have you open your mouth for me. Okay. Mucous membranes are pink and moist. Could you stick out your tongue? Wiggle it back and forth. Say ah.
Ah.
Alright. Tongue is midline. Uvula is midline. And cranial nerves 9, 10, and 12 are intact. Now I'm going to have you turn your head and I'm going to assess your ears. Okay. No discharge, no lesions, no excess chromin. Now I'm going to have you close your eyes and let me know which ear you hear the sound in.
Right, left, left.
Perfect. Cranial nerve 8 is intact. Now I'm going to have you shrug your shoulders, turn your head into my hand, turn your head into my hand. Cranial nerve 11 is intact. Now I'm going to have you, I'm just going to check your lymph nodes, okay? This is preauricular, postauricular, occipital, anterior cervical, posterior cervical, tonsillar, submandibular, submental, supraclavicular, okay? Now I'm going to go ahead and assess your thoracic cage. Okay, it is 1 to 2 ratio AP to transverse. Now I'm going to assess your breath sounds. Could you stand up for me?
Sure.
And then just continue to breathe normally. Alright, lift up your arms. Alright, and could you turn all the way around for me? Okay, lung sounds are clear. Stay turned around for me. I'm going to assess your spinal alignment. Spinal alignment is straight. Now, could you take a deep breath for me? Thoracic expansion is symmetrical. Now I'm going to assess for your CVA tenderness. Does that hurt?
No.
Does that hurt?
No.
No CVA tenderness is found. Now could you turn around and sit down for me?
Yes.
Alright. I'm going to assess for your respiratory rate. Respiratory rate is 12 with adequate depth, no accessory muscles used, and no cough. Now I'm going to go ahead and assess for your heart sounds. Okay. Starting with your aortic valve at the second intercostal space on the right sternal border, over to your pulmonic valve at the second intercostal space on the left sternal border, down to your Erb's point at the third intercostal space at the left sternal border, down to your tricuspid valve at the fourth intercostal space at the left sternal border, over to your aortic mitral valve at the fifth intercostal space at the mid-clavicular line. Okay, S1 and S2 sounds were present. Now I'm going to have you lay down for me.
Sure.
Okay. And when was your last bowel movement?
About an hour ago.
And was it normal?
Yes.
You didn't have any pain?
No.
Alright. And how about urinary habits? You don't have any troubles with frequency, odor, burning, nothing?
No.
Okay. So I'm going to go ahead and assess your bowel sounds, starting in your right lower quadrant, moving up to your right upper quadrant, moving over to your left upper quadrant, down to your left lower quadrant. Okay. Bowel sounds were present in all 4 quadrants. Now I'm going to go ahead and palpate. Just let me know if you have any pain or tenderness, okay? Right lower quadrant,
No pain.
right upper quadrant,
No pain.
left upper quadrant,
No pain.
left lower quadrant.
No pain.
Perfect. Okay. So I'm going to have you stand or sit up for me. We're going to go ahead and assess all of your pulses now, okay?
Okay.
And if you could just, I'm going to do your carotid first, but I have to do that one at a time. Okay? Okay? Down to your brachials. Okay? And your radials. Okay? Down to your popliteals. Alright. Back to your posterior tibials. And your dorsal pedis. Alright. All pulses were strength +2 and equal. Now I'm going to go ahead and assess your extremities. If you could just put your arms out for me.
Yeah.
Do you have any pain or tenderness?
Nope.
No pain, no tenderness, no edema is noted. So I'm going to go ahead and assess for your temperature. Temperature is normal and warm. No moisture, your skin is dry, not excess moisture. I'm going to go ahead and move down to your legs. Any pain, any tenderness?
No.
No edema is noted. Temperature is normal and warm. Skin is dry. Now I'm going to go ahead and assess your capillary refills. Okay. Both were equal in under 3 seconds. Now for the toes. Equal in under 3 seconds. Now I'm going to go ahead and assess your extremity strength. So if you could push up for me with all your right. Push down. Push out. Push down. Push up. Push down. Perfect. Now I'm going to go ahead and assess your could you stand up for me?
Yeah.
Sorry. Sorry about that, sir. Could you go ahead and walk for me? Beautiful. And when you turn around, could you flare your arms and lift up your legs while you walk backwards? Up and down, please, with your arms. Perfect. Now turn around. And could you move your neck? Range of motion and head, neck, and extremities are all normal. And I'm going to have you close your eyes. Okay? Gait is normal and Romberg test is negative. Now I'm going to go ahead and have you take a seat. And are you comfortable?
Yes.
Alright, well that completes our head to toe assessment. I'm going to go ahead and document my findings and do some hand hygiene. And I will see you later.